Hi, I'm Katie. I'm Lucy's mom.
And I'm Tim. I'm Lucy's dad.
SMARD1 is a neurological disorder. It stands for spinal muscular atrophy with respiratory distress. And it's a progressive condition that affects breathing ability, eating, and muscle strength. Because of her SMARD1, Lucy has low muscle tone, which means that her muscles aren't as strong as a typical child of her age. So she's not able to do many of the things that a typical 1-year-old would do. She has very, very, very low muscle tone in her torso area, which makes sitting up a big challenge. She's not able to speak. She can make noises around her trach, but right now she just kind of makes quiet noises.
At some point, she might be able to speak and say things. It's kind of yet to be determined. Kids with trachs, they can't. Something with the trach blocks their vocal cord, so they can't really talk right away. But it's something that they can learn to do.
She does have a lot of movement, though, more than what even some doctors were expecting. She's able to kick her legs. She's not able to lift them, but she can kick them out. She eats every 4 hours, like a typical baby, via her G-tube. Lucy requires 24/7 care. Since she has some limitations and special needs, we do have to have a pretty regimented schedule. Every 4 hours, we do a respiratory treatment for her where we help break up some of the mucus, and we use something called cough assist to help her kind of cough it out. Every night we have to do what we call trach care. So every night we change the ties that hold her trach on her neck, and we clean the area, we change the dressing that's there, and we clean her G-tube area. There's a lot of supply and equipment management that goes with having a child like Lucy. She uses her ventilator 24/7, so she is never not attached to a machine.
There's a lot of equipment, a lot of bags that we need to bring with us. She has a stroller, a medical stroller that can break down for convenience. We have an emergency airway bag, so if anything goes wrong, we have all of our emergency supplies in that bag. And we usually have a third or fourth bag of just miscellaneous stuff that we might need. It's not easy, but it's necessary.
It's really important to us that Lucy have as much normalcy in her life as possible. We do everything we can to make that possible for her. So her disease is progressive. She'll get weaker. She could have increased trouble breathing. More and more parts of her body could be affected by this disease, and it's hard to know exactly what it will look like for her. Currently, there is no treatment for SMARD1, and it's considered a fatal disease. So our job is to take as best care of her as we can and make the most of our time. There is hope for treatment in the future. They're currently working on gene therapy treatments, but we have really high hopes